Imagine you're lying on the concrete. You've just been in a terrible accident. You're in agonizing pain, staring up at the sky, and a terrified bystander pulls out their phone to dial 911. In almost any other developed country on Earth, the sound of an approaching ambulance brings an overwhelming sense of relief. It means salvation. It means you're going to survive. But here, you beg them to hang up the phone. You would rather risk permanent physical damage. You would rather risk bleeding out in the street than face the financial execution that comes next. Because you know that the bright red and blue vehicle rushing towards you is no longer a symbol of rescue. It is a multi-thousand-dollar financial kidnapping. We are raised to believe that the healthcare system is a safety net, a fundamental pillar of a civilized society designed to heal the sick and protect the vulnerable. We believe that doctors, hospitals, and pharmaceutical companies are fighting a noble war against disease. But what if the system isn't broken at all? What if it is functioning exactly as it was designed? The terrifying reality is that modern healthcare is not a service. It is an extortion racket. It is a highly optimized, completely unregulated wealth extraction machine that views your physical body not as a patient to be cured, but as an asset to be drained. They have engineered a system where the cost of a single emergency can instantly wipe out a decade of your savings. They have created a world where staying alive is the most expensive luxury item on the market. Welcome to the Blueprint. Today, we are tearing open the locked doors of the medical cartel. We are going to expose the phantom pricing of hospitals, the mafia tactics of insurance companies, and the darkest secret of all, how Wall Street turned your sickness into a permanent, lifelong subscription. Imagine walking into a restaurant. You sit down and the waiter hands you a menu, but there is one terrifying detail. There are absolutely no prices. You order your meal, you eat, and you leave. Weeks later, an envelope arrives in the mail. You open it, and the restaurant is charging you $5,000 for a basic hamburger and $200 for a glass of tap water. If a restaurant did this, they would be shut down for fraud by the end of the day. But in the American healthcare system, this isn't fraud. It is the standard operating procedure. It is a system built entirely on a financial blindfold. You go to the emergency room, vulnerable and in pain. They give you a single Tylenol pill that costs 10 cents at a local pharmacy. The hospital charges you $150 for it. They hang a bag of salt water above your bed to keep you hydrated. That bag costs them $1.50 to manufacture. They charge you $700. How is this legally possible? It all comes down to a deeply guarded, highly secretive document that every hospital maintains, but no patient is ever allowed to see. It is called the Chargemaster. The Chargemaster is a master list of prices for every single procedure, pill, bandage, and hour of labor in the hospital. But here is the darkest secret of the medical cartel. The numbers in the Chargemaster are completely fabricated. They have absolutely zero connection to the actual cost of your healthcare. They are fictional numbers, artificially inflated by hundreds, sometimes thousands of percent, to create a rigged game. The hospital intentionally sets the price of an MRI at $10,000. Why? So the massive insurance companies can step in, negotiate a discount, and only pay $4,000. The insurance company gets to look like a hero to your employer by securing a massive 60% discount. The hospital is perfectly happy because $4,000 is all they actually wanted in the first place. It is a coordinated financial dance between two giants. But what happens if you don't have insurance? What happens if the ambulance took you to the wrong hospital and you are out of network? You don't get the secret discount. You get hit with the raw, unedited, fictional Chargemaster price. The hospital demands the full $10,000. They are punishing the poorest, most vulnerable people in society with fake prices, simply because they don't have a corporate giant to negotiate for them. But the hospital is just the middleman. Because the true extortion starts long before you ever reach the emergency room. It starts in the laboratories of Big Pharma. When you think of a pharmaceutical company, you are trained to picture brilliant scientists working around the clock to eradicate disease. You think of the polio vaccine. You think of humanity's greatest minds fighting to save lives. But Big Pharma is no longer driven by the desire to cure you. They are publicly traded megacorporations. And like every other corporation on Wall Street, they are legally obligated to do only one thing: maximize recurring revenue for their shareholders. And that creates a terrifying conflict of interest. In 2018, an analyst at one of the largest investment banks in the world released a private report for biotech investors. The report asked a simple, brutal question: is curing patients a sustainable business model? Their answer was no. Think about it from a purely financial perspective. If a company invents a pill that cures a terrible disease permanently, they get paid exactly one time. The patient goes home, gets healthy, and never buys that drug again. In the eyes of Wall Street, a cured patient is a lost customer, a permanent loss of revenue. So, the cartel shifted their massive resources. Instead of prioritizing permanent cures, they realized the real money was in treatments. They realized that if they could invent a drug that only masks the symptoms of a disease, they could force you to take that drug every single day for the rest of your life. They turned your physical health into a subscription service. It is the exact same business model as a streaming platform or a software company, but with the ultimate brutal leverage. If you cancel your Netflix subscription, you lose your movies. If you cancel your medical subscription, you lose your life. Millions of Americans are now chemically chained to a daily regimen of overpriced pills just to function. The cartel keeps you sick enough to need them, but alive enough to keep paying them. But inventing the subscription was only half the battle. They needed an enforcer. They needed a massive, ruthless middleman to make sure the money never stopped flowing and to deny you the exact care you were promised. You pay thousands of dollars a year in premiums. You sacrifice a huge portion of your hard-earned paycheck for something called health insurance, believing it is a financial shield. You think it is there to protect your family in your darkest hour. But health insurance companies are not healthcare providers. They are financial institutions, and their entire business model is built on a direct, undeniable conflict of interest. It is a zero-sum game. Every single dollar they spend on your chemotherapy, your emergency surgery, or your prescription medication is a dollar subtracted from their quarterly profit. To an insurance company, you are not a patient. You are a financial liability, a risk that must be aggressively minimized. That is why they invented the ultimate weapon of medical extortion: prior authorization. When your actual doctor, a medical professional with a decade of training, looks you in the eye and tells you that you need a life-saving procedure, they cannot just treat you. They have to beg the insurance company for permission to use the money you already paid them. And the cartel doesn't even use human doctors to review your case anymore. They use algorithms, AI software specifically trained to mass deny hundreds of thousands of medical claims in milliseconds. They automatically reject your scan. They automatically reject your medication. They force your doctor to spend hours fighting on the phone, burying them in bureaucratic paperwork. Why? Because they know the psychology of a sick person. They know you are in pain. They know you are exhausted. It is a war of attrition. They are weaponizing your sickness, hoping you will simply give up and pay for it out of your own pocket. And if you do give up, if you are forced to bypass the insurance you already paid for just to save your own life, the cartel springs their final trap. The trap that takes absolutely everything you have left. The cartel denied your claim. The hospital billed you the phantom price. You survived the physical disease, but now you are facing a financial execution. Medical debt is the #1 cause of personal bankruptcy in the United States. It doesn't matter how hard you worked. It doesn't matter how responsible you were. A single diagnosis can instantly wipe out 20 years of your savings. And when the cash runs out, the collection agencies do not stop. They demand the liquidation of your entire life. To pay off the medical cartel, You are forced to sell the only real asset you have left. You are forced to surrender your sanctuary. You have to sell your home. But here is the most twisted, sickening part of the entire system. Because you are desperate, and because you need the money immediately to avoid total ruin, you're forced to sell your house below market value. And you aren't selling it to another family. You're forced to sell it to the massive Wall Street hedge funds that are waiting to exploit your crisis. The exact same financial system that bankrupted you in the hospital bed is now buying your house for pennies on the dollar to rent it back to you for the rest of your life. It is an ecosystem of absolute extraction. Wall Street used your medical crisis to steal your neighborhood. If you want to see exactly how these mega funds orchestrated the greatest real estate heist in human history, and how they plan to make you a renter forever, click the video on your screen right now. The machine is connected. Stay awake. See you in the next one.